Hello! In this video, we will teach you the basics of the ZOLL R-series. The purpose of this video is purely educational. We will self-test the ZOLL, demonstrate proper placement of the pads, identify the CPR monitor, perform unsynchronized cardioversion or defibrillation, perform synchronized cardioversion, perform transcutaneous pacing, use the ZOLL as an AED, and troubleshoot. Let's go over your needed supplies: the ZOLL R-series, pediatric or adult pads, and pacer leads. The ZOLL is indicated for use in situations in which the patient is either at risk for, suspected, or known to be having a cardiac arrhythmia or cardiac arrest. For example, unstable and/or unresponsive patients and patients being treated according to a PALS algorithm. Testing the ZOLL. Before using the ZOLL, make sure that the green check mark is in the upper window. If there is a red X, it is most likely due to the following 3 reasons: the ZOLL is not plugged in, the ZOLL battery is not connected, the daily self-test has not been done. If the ZOLL is plugged in, then the machine will do a daily self-test on its own. You can perform the self-test by doing the following. Make sure that the ZOLL is not connected to any pads or patient. Turn the dial to defib and adjust the energy select to 30 joules. Press charge and wait for the shock button to light up. Before pressing shock, make sure that the ZOLL is not connected to any pads or patient. Press shock. This will trigger the ZOLL to perform the self-test. If it is working properly, then the digital screen will read self-test complete. If the screen does not read self-test complete, then the ZOLL unit is defective. This ZOLL cannot be used in emergency situations. It should be immediately removed from the patient care area and replaced. ZOLL pad use. Use a new set of ZOLL pads for each patient. Make sure that the package is unopened and appropriate for the patient's age and weight, such as pediatric pads versus adult pads. The connector is meant to be hanging outside of the unopened packaging. If only one set of pads is available and they are not the correct size for your patient, it is still okay to use those pads. Also note, all pads have an expiration date that is indicated on the outside packaging. Upon opening the package, you will see the pads are attached to a clear protective film covering the leads and adhesive. On the front of the pads will be pictures corresponding to the placement on the patient. The anterior pad will have the CPR monitor that will go at the base of the sternum between the nipple line. The posterior pad will go on the back. Position the pad on the back, to the left of the spine and under the scapula in an adult. In a child under 8 or less than 25 kilo, position the pad in the midline between the scapula. When placing the pads on the patient, make sure that the skin of the chest and back is bare, clean, dry, and without obstruction. Clothing, bras, metal jewelry on the chest, and medication patches should be removed. Excessive chest and back hair should be removed. This can be done by shaving. Alternatively, apply a spare set of adhesive pads, then strip off the pads to forcefully remove the hair. Then place a new set of pads in those locations. Try not to place the pads over wounds or rashes. Once the pads are on the patient, make sure that you connect them to the ZOLL. The adapter should be found on the side of the ZOLL in the docking station. While lifting the latch on the adapter, forcefully push the 2 ends together. If the ZOLL reads check pads, please repeat the previous steps or use a new set of pads. CPR monitor. On the anterior chest pad, there is a CPR sensor. It is a red cross with a surrounding black circle. The CPR monitor is in the top middle section in pink. This sensor will keep track of your idle time off the patient's chest during pulse checks and in between cycles. You can also monitor the compression rate, compression depth, and release in between compressions. Performing unsynchronized cardioversion or defibrillation. When performing unsynchronized cardioversion or defibrillation for unstable ventricular tachycardia without a pulse, or ventricular fibrillation, you need to set the dial to defib. Make sure that you are not in monitor mode. Monitor mode will only allow you to see the cardiac rhythm but not perform any therapeutic electricity. After identifying the patient's weight, either from the medical record or a Broslow tape, calculate the first electrical dose. For the initial pediatric unsynchronized cardioversion, it is 1 to 2 joules per kg. The next dose for unsynchronized cardioversion is 2 to 4 joules per kilogram. Input this amount by using the energy select up and down arrows. Once you have entered in the correct amount, press charge. The ZOLL will then charge up to the desired energy. The shock button will then light up. Once the desired energy is achieved, prepare to administer the charge. Confirm that no one is touching the patient. Remove high concentrations of free-flowing oxygen from the patient. You can communicate this by saying, "I'm clear," "You're clear," "We are all clear." You might also hear this as, "I'm clear," "You're clear," "Oxygen clear." When it is safe, press the shock button and immediately resume CPR. Performing synchronized cardioversion. Follow these steps to perform synchronized cardioversion for unstable ventricular tachycardia with a pulse, or supraventricular tachycardia. Set the dial to defib. A sync button will appear on the screen at the bottom right-hand corner. You can only see this button when the ZOLL is in the defib mode. Make sure that you are not in monitor mode. Monitor mode only allows you to see the cardiac rhythm but not perform any therapeutic electricity. Press the sync button to turn the ZOLL from defib to sync mode. When the ZOLL is in sync mode, the home screen will display sync in front of the Joule selection instead of defib. Dots will appear above each QRS complex. After identifying the patient's weight, either from the medical record or a Broslow tape, calculate the first electrical dose. For the initial pediatric synchronized cardioversion, it is 0.5 to 1 joules per kg. The next dose for synchronized cardioversion is 1 to 2 joules per kilogram. Input this amount by using the energy select. Once you have entered in the correct amount, press charge. The ZOLL will then charge up to the desired energy. The shock button will light up. Once the desired energy is achieved, make sure that no one is touching the patient before giving the charge. You can communicate this by saying, "I'm clear," "You're clear," "We are all clear." You might also hear this as, "I'm clear," "You're clear," "Oxygen clear," if the patient is actively being bagged. When it is safe, press the shock button. The ZOLL will immediately default back to defib mode after delivering a synchronized charge. If an additional synchronized charge needs to be delivered, remember to turn the ZOLL back to sync mode. You will need to press sync prior to entering your desired charge. When the ZOLL is in sync mode, the home screen will display sync in front of the Joule selection instead of defib. Dots will appear above each QRS complex. The ZOLL is now ready to administer another synchronized charge. Performing transcutaneous pacing. When performing transcutaneous pacing for unstable bradycardia, you need to set the dial to pacer. Make sure that you are not in monitor mode. Monitor mode only allows you to see the cardiac rhythm but not perform any therapeutic electricity. In addition to the adhesive ZOLL pads, you must apply the pacer leads onto the patient. The ZOLL pads will provide the electricity to pace the patient, and the leads will capture the rhythm. The pacer leads are normally color-coded to white, black, and red. They can also be white, black, and green. The white lead will go over the patient's right upper chest. The black lead will go over the patient's left upper chest. And the red lead will go to the patient's left lower chest. This will often be referred to as white over right, smoke over fire. Once the pacer leads have been attached, you will see pacer marks on the inferior or downward axis of the rhythm strip. The patient's actual rhythm will appear on the positive axis as upward deflections. To begin pacing, turn the right lower dial marked rate, measured in ppm or pace per minute, to achieve the desired paced heart rate. You will see the rate change on the digital screen. Next, you need to increase the energy output. Turn the left lower dial marked output, measured in milliamps. Increase the output energy until there is a downward pacer wave before each upward QRS complex. This is called the patient's threshold. Set the output energy to 10% above the threshold. Once you have done this, you are now pacing the patient. If you want to see the underlying rhythm, you can temporarily pause the pacing. Press and hold the 4-to-1 button. This will show you 4 QRS complexes without the pacer, and then 1 paced complex. You will be pacing the patient slower when you are holding down the 4-to-1 button. As soon as you let go of the 4-to-1 button, you will resume transcutaneous pacing at your desired rate. Using the ZOLL as an automated external defibrillator, AED. If you want to use the ZOLL as an AED, turn the function dial to defib. Instead of entering your desired charge, press Analyze. The ZOLL will identify the rhythm and advise if a shock is recommended. If shock is recommended, the ZOLL will automatically determine the necessary voltage and charge on its own. When the charge is ready, the shock button will light up. Make sure that no one is touching the patient before giving the charge. You can communicate this by saying, "I'm clear, you're clear, we are all clear." When it is safe, press the shock button. Troubleshooting. If you accidentally charge the ZOLL to the incorrect dose, you can always abort the charge by pressing either the up or down button of the energy select. You can then enter in the correct charge dose. You have now completed this video and should feel confident in using a ZOLL R-series monitor. Thanks for watching and good luck.